Good evening, everyone. My name is Kyla Haddington, and I am the Public Outreach and Engagement Division Manager for the Prince George's County Office of Human Rights, with the county's Civil and Human Rights Education and Enforcement Agency. It is my pleasure to welcome you this evening into another one of our partnership events with the wonderful, absolutely wonderful Prince George's County Memorial Library System. This evening, we are talking about health insurance for Marylanders with a specific focus on Latinos and health insurance. July 15th is the final date for a special enrollment program for taxpayers, so we're going to touch a little bit on that. And we know that health impacts so much of our lives, and equitable access to health care and health insurance is not only a matter of social justice, but an issue that impacts all of us throughout all of our lives. How we can ensure all people are able to access health insurance and through that, necessary health care. Tonight, we have two very special guests. Shari Curtis, who is the project manager of Prince George's County Health Connect, a program of the Prince George's County Department of Social Services and the Maryland Health Connection. Accompanying Shari is one of her senior navigators, Milvia Pinata. Welcome, Shari and Milvia. We have a lot to talk about tonight, and I'm so glad you're here. So first of all, welcome to both of you. And sorry.
Sorry.
Thank you.
And Shari, I was hoping you could open us up just by talking about what is Prince George's County Health Connect.
Well, as you stated, Prince George's County Health Connect is a program of the Department of Social Services. We are actually getting ready to go into our 10th year of implementing the Affordable Care Act. Maryland Health Connection is the marketplace where people are able to get health insurance in Maryland. And it is an exchange. The Maryland Health Benefit Exchange is one of several state exchanges in the country. A lot of people are familiar with healthcare.gov, and that's not us. Maryland Maryland is actually an independent exchange that has its own program. If you go to healthcare.gov and you put in your zip code for Maryland, it will direct you to marylandhealthconnection.gov. But one of the wonderful things about Prince George's County Health Connect, it provides local residents with access to consumer assistance to be able to learn their eligibility and get enrolled in health coverage. There are many aspects of the program. There's many different levels of coming into the program. It is mostly based on your residency and your income and your family size. And so simply put, if you are lawfully present in this country and you are a resident of Maryland and you do not have employer coverage or any other coverage, you should come see somebody like Milvia Pinata and find out how you can get access to health coverage. I also wanted to say that access to health coverage is one of the social determinants of health. And without that access, you are not able to engage with a medical home and get the kind of health care that you need. And primary care is just so important. And I don't think there's been ever a time in our history where having health coverage was more important than what we've experienced in this recent public health emergency. And I'll just stop there and we'll answer other questions as we go along.
Well, sorry, Milvia, did you want to add anything to that before I just start tearing off some other direction?
Actually, I think Shari covered most of it, if not all of it. It is actually it's like Shari mentioned, it's not part of the healthcare.gov, since the Maryland has its own program running as well. And with Prince George's County, we'll also emphasize on helping and assisting our community as well.
Okay. So one of the things that came to mind just from your introduction for me and maybe for other people watching is our health. I know it's not the same thing as healthcare.gov. And if you go to healthcare.gov, you're going to be, am I right that you're going to be redirected to Prince George's County? And so I know that you have a title, Milvia, of being a navigator, a senior navigator. Am I right? If somebody needed access to healthcare, would they be paired up with a navigator, or how does your function work?
So we have different channels where they can find the assistance that they need. The website is one where they can just access the website and apply on their own if they feel like it's not an easy application process. But if the process is confusing because we sometimes will ask about taxes or immigration statuses, that can be confusing and overwhelming at times. So that's why we are there to assist the consumer in person to answer any questions they might have, especially about what to include in the application as part of their income or who to include in the household. Because even though you might live with other members in a household, not everybody is considered your dependent. So we try to help you navigate the system. And if we are not there to help you in person, we also have a call center that we can provide you assistance with. You will call us directly, and we are the same people that you will see in person answering the phone calls, just so you can have the familiarity with the assistance that we provide you.
Awesome. So I know, and Shirley, you mentioned that this is the 10th, or it's coming up, right? July 1st, the 10th anniversary of the Affordable Care Act. So that's
Well,
amazing.
the anniversary was last year
Oh, it was last year.
of the act being passed.
Yes.
But we're getting ready to enter the 10th year of implementation because you need
Okay,
time.
right, okay.
So
That's a good correction. Yeah.
we're kicking off year 10 of actually providing the services under the Affordable Care Act. So we're very excited about the longevity of this initiative and the opportunity to be able to serve our residents.
So you mentioned health insurance being one of the social determinants of health. So can we talk a little bit more fully about that for maybe people who aren't familiar with that expression? Like, what does that mean?
Well, one of the things we want people to understand is healthcare is not only about health. There are a lot of things that impact health. There could be financial situations, there could be housing, there could be access to health coverage, access to a primary care provider. There could be substance abuse disorder. And what we try to do in terms of addressing the social determinants of health is remove the barriers that would cause a person not to be able to reach the maximum health that they could achieve. So access to health coverage is on the list because without that, you don't have the same opportunity. I mean, and it's an equity issue. I know earlier we had talked about, health equity, and, one of the things that this program provides is equal access to health coverage for people that are lawfully present residents, of the county. It's not free for everyone. It's a situation where it's based on income and family size.
So is that, like, when you say that, is that a sliding scale, or is that eligible, ineligible in terms of, is there like a cap where?
Well, every year there's a review of what the federal poverty level is, and that usually is determined by the federal government, not by us. But what we do is we try to work with families. There are opportunities for tax credits based on family size and income. Some people are eligible for Medicaid because Maryland is a Medicaid expansion state, meaning you could actually be a working person and still receive Medicaid. Some people receive care for themselves at low cost, but no cost for their children. So that's why it's important sometimes to speak to somebody like Milvia, because there's a lot of nuances in the program that will allow people to be able to leverage their needs, their healthcare needs, as well as what works for their budget.
Are you finding? Well, I guess I have a lot of questions, so I'm going to try and stay focused. I do want to know, and Milvia, I don't know if this is a question for you, but either one of you. Are you finding it difficult to get eligible Prince Georgians registered? Are there challenges that you're facing with that?
I actually believe that there is. There's a lot of people, at least when we are assisting the residents, sometimes they're not aware of the resources that they have. We have had people coming in and saying that they didn't know they could qualify for benefits, either through the state or through the qualified health plan. And that is a little bit shocking to us, because even we have been advertising, there's still so much to do to reach the community, to let them know that there are resources that they can apply for. there is assistance so they can have access to healthcare. So
Right.
for me, that's one of the challenges is that not everybody is aware of the program, even if we have done multiple outreach programs. We have gone to the school systems. We have gone to parent teaching conference. We have gone to events that has been taken care of in the park, or we have gone to health fairs. And even if we when we try to cover all that outreach, there's still so much that we need to do. And I feel that that's one of the barriers that they're not aware of, the benefits they could qualify for.
Right. Right.
One of the things that's really helpful is programs like this.
Yes.
Because when we are out in the community, we meet people that may have coverage, but when they learn about what we have, they have a family member or a cousin or a nephew or a grandson or somebody they know in their community or in their church that doesn't have health coverage. So the library system has been great because they host a lot of virtual events and they have a lot of outreach to people in the community. And Milvia is correct. We have a lot of people that are either hard to convince, worried about what it might cost, so they just stay away without even trying to find out. Or, I'm not saying people are sleeping under a rock, but a lot of people do not and are not aware that it's for them. I mean, we have people like musicians or, artists and other residents, that are lawfully present that just don't think that they're eligible for coverage. And sometimes they're shocked when they meet us and find out that they can get in for either at no cost or very low cost for coverage. And then they get excited. Oh my gosh, I can go to the doctor. And I will say we have 20 full-time navigators working in our program. 17 of them are bilingual. So we do, and we have language access lines for people that speak languages other than English and Spanish. So we are able to serve many members of our community, and we don't want them to think language is a barrier. We serve people from 18 to 64.
Okay.
So we're not a Medicare program, but we also serve children of families that are under 18. So there's a wide range of people that we serve. We believe that there are close to 100,000 residents in Prince George's County that still don't have health coverage.
That was one of the questions when I said I had multiple questions. That was one of the ones. Okay,
well,
so
it hits to this, but a lot of the data that we have is from 2020 census and it's pre-pandemic, and we don't think the numbers are great. But we do believe that there's at least 45 to 49,000 eligible residents in Prince George's County that could get health coverage if they reached out to us.
Wow.
Many of the residents are undocumented, and so they're not eligible for the state exchange program, but their children are.
Okay, so let's talk more about that, because I think that's huge. Because I know we've been using the term, what's the term? Legally present, right?
Lawfully present.
Lawfully present. I'm so sorry. Lawfully present. So really we're saying you don't need to be a citizen. That is not a requirement. But citizens and all people who are lawfully present. And you're also saying the children of people who maybe are here without documentation, that their children are eligible or could be eligible.
That is
so
correct.
How is it for people? And I think that, I know that for people who are concerned about their legal status in the States, it can be very intimidating, or in fact, downright, like they would never go to a government service, right? Because you don't necessarily want to be visible. How can we, or what is it that you folks are doing to help people feel comfortable to know that it's okay to come and talk to you for their children?
I'll let Milvia start and then I'll follow up.
So usually, if someone who is undocumented, we try to protect their information from not sharing it with any other organization, so they feel safe when they come. We let them know that the benefits is for their children, but I would just want to mention something really quickly based on that as well, is that even if they're undocumented, there are other resources they can obtain. Not through the program, but we are navigators, not only assist them with enrolling them into a health plan, but also directing them to find different resources. But to go back to the question, we will want to make them feel welcome. We want to make them feel like the information will not be shared with anybody. And we try to emphasize that it's very important for their kids, for their children, for the family member to enroll in a healthcare coverage. Like Sherry mentioned previously, it is especially during this time, it's very imperative for them to have health coverage.
Mm-hmm.
We have a wonderful opportunity in Prince George's County with fairly qualified health centers who see people regardless of their ability to pay. And
What was the? I'm sorry. What was the phrase?
federal, yeah, they call them FQHCs for short, Federally
Okay.
Qualified Health Centers. They're community health centers that are located in Prince George's County. We have 6. And those health centers are available to residents who are seeking health care and may not have coverage. A lot of those health centers refer people to the navigators if they determine that they may be eligible for coverage. But there are lots of other resources available for people. We don't want anybody to not come because they think they're not eligible. And navigators have built resource directories. They know how to help people identify lots of information, even information that's not related to health, because that's what we do. You know, we're there. We answer the phones, and we're there to help people. We only have certified staff, and I want to just talk a little bit about certified staff because all of our navigators have been certified by the state. They've taken online modules and tests and training, and every year they have to update their certification. We take personal identifiable information very seriously. The most important thing to us is that people understand that their privacy is protected and that anything they share with us stays with us. And all of the online application process is all secured. And people who are, pretty savvy at using the computer, for the most part, can set up their own account and go right through the process and determine their own eligibility and select a provider and move right along. I think Milvia mentioned earlier that if they reach a point in the application where they get stuck or they get confused, then there's a way for them to contact us to help them complete their application. You mentioned earlier in the program that there was a deadline coming up, and I just wanted to touch on that really quickly. We do have like open enrollment, which is usually November 1st until sometimes December 15th, sometimes December 30th. Last year it was in January. And that's the open enrollment period specifically for people who need to either change, get, or update a private plan. And those are plans that may have low cost, limited costs, or significant costs, depending on family size. Medicaid is available year round. But during the year, there are several special enrollment periods. And a special enrollment period is where people, if they fit into certain categories, are eligible to enroll into a plan, even if it's off the open enrollment. One of the special enrollment periods is one that deals with life events. If you had a baby, if you had a change in family size, if you got married, if you got unmarried. If you lost coverage due to being unemployed and you no longer have that coverage anymore, that would be considered someone eligible for a special enrollment period, which is a life event. But then there's other special enrollment periods that have occurred in our lifetime. During the pandemic, there was a COVID special enrollment period. So everything was off the table. If anybody needed health coverage, there was no limit to whether or not you could come in or not come in. It was open to everyone. And Maryland has a very interesting program called the Maryland Easy Enrollment Program. And when a person fills out their state tax form, there's a little box that they can check that says they're interested in getting health coverage. You may remember when the ACA was first implemented, there was a penalty, a tax penalty. If you didn't have health coverage, you had to pay, I think it was $95, and then it went up a little bit or a percentage of your income. So when the administration changed, the tax penalty went away. But Maryland was very intent on trying to encourage people to get health coverage, and they didn't want the fact that the penalty went away to mean that people shouldn't get health coverage. So you are eligible during the entire tax period from January, whenever, the tax period starts, up until the 15th of next month,
Okay.
to enroll in a health plan if, in fact, you filed your taxes.
Okay.
So that's the trick. You got to file your taxes. You got to check the box. And if you check the box, you can see Milvia, and Milvia will enroll you in a plan that meets your budget and your healthcare needs. So that's why, one of the reasons why we really want to talk to everybody today, because if there's anybody who hasn't completed their taxes because there was an extension for Maryland for the state tax and needs to complete their taxes, if they do not have health coverage, they certainly can reach out to us and we can get them enrolled in a plan.
Right. So there's still time. So that's really, really important to know.
There's still time.
Right. So the big things that I'm hearing, and I want to just echo them, and you can correct me, but also I want to amplify them if I'm right, which is you can get health insurance. If you don't know, or you just assume it's not for you, or you can't afford it, or you're not eligible, you should call PGC Health Connect. And I put their website into the chat. I'll put it online again, but make sure you reach out to them, because they're going to be able to tell you.
Right. And
yes,
they can call. Right. They can call 301-927-4500.
301. Let me get this. I'm going to write it down. 301-927
4500.
45.
45?
500.
45?
4500.
Okay, that was everybody at home is like, we got it, Kyla. I didn't get it. But we have it now. Okay.
Can I also add something to what Shari just mentioned about the life events? And it's that that's one of the things that we also encounter, is that those people who lost their jobs and they're currently under COBRA, they also could check there to see if they're eligible to receive assistance and not pay the high premiums of the COBRA insurance.
So that actually, I wanted to talk about the insurance, because you mentioned, Shari, you talked about marketplace. So I could guess and speculate what that is. But I'm hoping you can explain, like, what does that mean? Who are the vendors? What is marketplace?
There's 3 providers right now in Prince George's County. There is Kaiser, Care First,
okay,
and United Healthcare.
Right.
And those are the 3 providers that offer private insurance.
Okay.
And one of the things that Milvia was trying to highlight, that a lot of people who lose employer coverage, when they're faced with the COBRA bill, it's like cost prohibitive, particularly if you're on unemployment. And we like to let people know that during that interim period, while they're still job seeking, that they can come to us and make sure that they and their families remain covered, because coverage is really important, and we don't want them to lose coverage and go without health care during that period of job seeking or being unemployed.
So with COBRA, if you're covered under COBRA, so you've lost your job, you're on COBRA, we come to you. We can then transition. If we find a better plan, we can transition to it. Is there any risk with losing COBRA, or is there any risk to us in terms of transitioning to a different insurance company?
Most of these insurance companies, except for Kaiser, you don't even have to change your doctor. And some people are with maybe Care First on their job, and so the transition, is somewhat seamless.
Right.
There is a short little period. If you already accept COBRA, then you may have to have a short waiting period. But the navigators are so good at figuring all that out that we just don't want anybody to have miss an opportunity to be covered. And there are a lot of people who are nervous about it, and so they go without coverage because they can't afford the coverage, and also being on unemployment insurance.
Right. Who is the other, for people who are between employment, people who are maybe anxious about going to access government services? We have people who maybe just automatically assume that they don't qualify. Is there another group of people that you feel like should come to you that maybe are reluctant?
We want everybody to come. Right?
So
yeah, exactly.
Anybody who doesn't have health coverage needs to find out, you don't know what you don't know.
Right.
Right.
And one of the reasons why we're here talking to you is there are a lot of people that, don't know. Milvia suggested that people are sometimes just baffled by the fact that they are eligible for health insurance and didn't know. And I mean, we served a tremendous number of people during the pandemic. In fact, Prince George's County enrolled the largest number of people into the exchange than any other area in the state.
Wow.
And one of the things we attribute to that, and while it may not be a kudo in terms of the reasons why people had to come to us, because it was the pandemic and they may have reached a hardship where they had to, but one of the things that we believe is that our marketing efforts and our outreach efforts and what we've done to try to let people know that we are here has been tremendous. We have a really strong, I mean, we were at food distribution sites,
Right.
Contactless, sticking flyers into people's food bags like every week while they were coming to pick up groceries during the pandemic. And there were people that were excited to know that there was a place to go. We had people that had significant losses in their family. The breadwinner died from COVID and the mother didn't know where to begin. And they learned about us and they were able to get coverage for themselves and their children. So, outreach is just so critical and so important to this entire initiative. Health literacy is so important. Recognizing that lack of health coverage is an equity issue, and having all of the voices in the community, like the Office of Human Rights and like other agencies, to be able to integrate this into their messaging to all the people that they serve. And our mission for fiscal year 23 is going to be all about integrated messaging. We want everybody who's talking to anybody in the community to add a bullet or two about health insurance, just so people understand that we are here, and having 100,000 people without health coverage is a public health crisis.
Right. What is that? 10% of the, am I right? Let me do my math really quick. Is that 10% of the county?
It's pretty close to that.
Oh, no.
Yeah, pretty close to that.
So I just want to echo, I need to say this as an outside observer, your marketing has been truly amazing. And so kudos to your team, Prince George's County Health Connect, Maryland, the Department of Health. I will say that I went to get a COVID test back in the early days, and I got this, through my window came this pile of papers, and in that pile of papers was like not only stay home but also about health insurance. And it was so and I was one of those people, and I'm going to say this because there may be people listening who did exactly the same thing I did. I was like, I don't need this. I have health insurance. Can you give it to somebody else? Like, not recognizing that I had a role to play. And so this is what I'm hoping we can talk about now. People like me, we're already insured. What can we do to help others get insured?
The best thing to do is, like you said, we have passed the message to someone, because when we do outreach, we don't know who's actually insured already and who's not insured. But because we have given you the power of passing the information over to somebody else, like Shari mentioned previously, there has to be someone, either your neighbor, your friend, your friend's kids, or someone who just got out of college, or someone who's just, starting their first job, but that job does not offer benefits. There is always someone who needs our assistance, who needs healthcare coverage. So that's one of the things that everyone who's watching this video or who's actually joining right now, they can do. So we are here to inform you of the benefits of the resources that we have, so we can decrease the health disparities and increase our number of insured people in the county and the state. And that's what we want. We want to spread the word to the next neighbor, to the next person, so we all can be united together, and we can all get better and healthier through healthcare access.
So basically, if you're like me, pass it on, and keep passing that information on.
Exactly.
So Shari, you were going to say something?
Well, one of the campaigns for the summer that we have going, and it's kicking off now, is the Turning 26 campaign. So what some people may not recognize, that you can be on your parents' health coverage if they allow you to be until you're 26. But when you turn 26, your date of birth is in their system, and your parents will get a letter letting you know that it's time for your kid to get some other coverage. They may offer you opportunity for them to get covered with that carrier, or they may just cut you off. So our campaign for the summer is going to be the Turning 26 campaign. And we want everybody who is going to be turning 26. And there are thousands of young people turning 26 in the state of Maryland. There are a few thousand in Prince George's County. And if they are not covered by their current employer, they are going to be without coverage, post their birthday. And we have a short film that's going to be a video that's going to be in the movie theaters in Prince George's County. If you get there early enough, after you buy your popcorn, it'll come on before the movie starts, and you'll see a Turning 26 campaign. And we'll be distributing flyers electronically and at our events throughout the summer about this Turning 26 campaign, and all the information on how to reach someone with us, to get assistance. And we also have a mobile app because young people are all about their devices, and we have a QR code that drives you right to marylandhealthconnection.gov on our flyers. And it's important for that group to understand that they can also do their setting up their account and doing enrollment on the mobile app, right on their phone. So there are so many ways to enroll in this program, and we've tried to think of every way. But we do believe, and like Milvia said, and like you've intimated, word of mouth is the key.
Yes.
People need more than 1, 2, 3, 4 times of getting this message before they jump on board. And so whether it's on the radio, whether it's from your church, whether it's from your neighbor, your cousin, whether your grandson is laying on the couch and not working right now, or somebody got laid off during COVID and they just are down in the dumps, you need to understand that having health coverage also provides an opportunity for behavioral health coverage. It's one of the essential benefits where you can get a mental health check. And, and it would be no out-of-pocket expense for the checkup because it's included as one of the essential benefits of the plans. And so, we don't want people to be in despair or feel like, they're hopeless right now during this tough time in our world, because a lot of us are challenged with issues as a result of this pandemic. And we just want you to have the card that gets you in the door.
Right. So I think that is a critical message for people watching now, or if you watch it later, which is that you are not alone. So that recognizing the heavy, heavy toll that COVID has taken and is taking, and that Prince George's County Health Connect is there to help you access insurance, which can include behavioral health care if you need it. And also, as Milvia talked about, other resources. And I think that is a really critical message. One of the things, as you were talking, I was thinking, I have a 23-year-old and a 19-year-old. So you mentioned 26. I mean, I can see that coming in the future. And I remember being a young person. And actually, I remember being a 48-year-old, which is right now, and sometimes feeling a lot of anxiety when I think about costs. So, maybe I can imagine my child looking towards turning 26, feeling this anxiety of like, oh my gosh, I can't afford health insurance. And instead of calling you, maybe feeling some panic and avoiding it. And so I'm mentioning that for people who are watching, if that's you, what my takeaway here is that this is not a scary place to call, that Milvia and other navigators are going to be able to, first of all, help you realize it's probably not as bad as you think that it is. And, do you think that when people come to you, is that an anxiety that you hear people have a lot, that they just think they're not going to call? It's going to be totally out of reach for them?
Well, it actually, we encounter a little bit of different groups. We have encountered those who says, well, I'm young, I don't need it. But after the pandemic, everything has changed, and we've seen it changing so much that we have seen more youth coming in and enrolling in the health coverage. And the great thing about the cost is that right now they're offering in additional assistance for anyone who's less than 30 years old. So not only you're getting the tax credit that you need, but you're getting an additional assistance, because we want everybody to get access. We don't want to exclude anybody. And even if you're young, just think about it. You still can have access to healthcare and get ready, be prepared for the future because we don't know what can happen. We want to be ready. And that's the opportunity that we're offering right now to help you enroll. If you, like you said, they might be a little bit skeptical, they might be a little bit afraid that they don't know how much it's going to cost them. But unless they don't come or they don't investigate or they don't get information, they will not know.
Right.
And sometimes the price that they will pay is actually less than what they're actually paying for their cell phones. So
Wow, okay.
it is really surprising.
Right. Right.
One of the things young people also need to know, Kyla, is you're saving for your car, or you're 25 and you have an opportunity maybe to get into a first-time home buyers program. So you're saving, right? And you don't have health coverage, and you break your leg. Stupid accident, dancing at the club, your pumps break, and you break your leg. A broken leg or a broken arm can cost you an upwards of $10,000 by the time you finish with the emergency room and the doctor and therapy.
Yeah.
And that could set you back 3 years or more in your savings. For some people, it can create a cycle of poverty that they were trying to work themselves out of.
Right.
And so when you do the math in terms of whether or not insurance makes sense to have or not have, those are kind of things that we try to emphasize when we do presentations out in the community, to do some comparison of what it could cost you by not having health coverage versus the little bit it could cost you to make sure that you do have it, and you can stay on your savings program and you can stay on your trajectory for taking care of other things that are more important, like maybe that vacation to Spain that you've always wanted. There's an opportunity for young people to really consider, where it makes sense to put their money and how to do it, because you don't want that kind of a setback.
Right. Right.
And medical bills, before the ACA, medical bills was one of the number one bankruptcy issues in America.
On a personal level, we have friends visiting us right now from Canada, and my friend borrowed my bike today, and he ended up in the emergency room today, and so I'm, as a visitor, we won't go into but as a young person, again, I know I've been young, and I think about health as sometimes when I'm older, I might have a health problem, but I don't think about just going for a bike ride, falling off my bike, and those kinds of things that can happen. So, I mean, not trying to be a downer, but I think this is such a good message for people who are listening to not be afraid to call you and to recognize. And I love this part that you're investing, a small amount to invest not only in your health, but also in your other dreams. You mentioned education or housing or a trip that, you can save for those things.
Right.
And your health is not going to empty your savings. A health emergency is not going to empty your savings account. I do want to say a couple of things for people watching. First of all, we have time for questions. So please, if you have any questions, please type them into the chat, because we're thinking of things, but if there's something that you need to hear and you're not hearing it from us, please let us know what that is. And I'll share it with Shari and Milvia and hopefully get you that answer. I also wanted to talk about two different things. I'm going to mention them now because I don't want to forget them. So one of the things that I do want us to talk about is your partners and the different agencies you partner with. And the second thing that I want to talk about is really the impact of COVID, the health disparities, the way communities of color have been disproportionately impacted, what that looks like, and as it relates to health insurance. So that's kind of a big thing, but I see the time ticking away, and I want to make sure we get to both of those. So I don't know if you want to start, either one of you want to start with either one of those, but.
Well, I can start with the bigger picture issue, because we want to remind people that we don't provide health care. We provide access to health coverage and encourage you to use your coverage. And so not everybody that works for Prince George's County Health Connect is very well versed on the impact of COVID, other than what they see through their lens.
Right. Okay.
But what comes to us is usually people who are in either desperate straits or got referred or have the need to get access to health coverage. So we don't have all of those answers.
Right.
But
Okay.
I do wear several different hats, and we do have partners that have answers to those questions. So I just want to make it clear that we're not healthcare providers, but we want to get you in there,
Right.
and that's our goal.
Hmm.
Yeah. The other thing I wanted to do in terms of addressing is I can highlight some of our partners because
Okay.
we could not do this without our partners. Mary Center, which is a partner where Milvia works. Mary Center is a large FQHC, fairly qualified health center, but they also offer a lot of services providing health care. And this program is one of the ways that they're able to refer people into healthcare and get them access to coverage so that they can support them. They also do a tremendous job with working with the families that have limited English proficiency, and so they have a niche in that world. And they're located all over the DMV, but particularly in Prince George's County and in Washington D.C. Another one of our partners is Healthcare Dynamics International, and they also provide us with several navigators. They're a navigator partner, but they're also a communications partner. They help us with our website, all of our graphic design, as well as our social media posts, and they're helping us build our social media presence. And both of these partners have been working with us since the inception of this program. SEED, Sowing Economic Opportunities and Economic Development. Sowing Empowerment and Economic Development. Got to get it right. So
Mhm.
SEED, they're located in the Riverdale area. The Riverdale area has a very high incidence of uninsured, and they have a senior level navigator that not only helps with that, but they are also an outreach partner. They operate a food bank. They do diaper distribution. They do first time home buyers training, and they integrate our message into everything that they do. CASA, which is one of the large organizations that focuses on families with limited English proficiency as well. They've been a partner since the very beginning. They're located in the Hyattsville area, and that's a meta focus area for us where there are a lot of people who are uninsured, many of them undocumented, but like I said before, we want the kids. They
Mhm.
have promotores, which are community health workers that are embedded in that community who are going to be doing outreach on our behalf. They do a lot of media coverage, integrating our message in Spanish language on television and all of that. So they are also a wonderful partner. The Prince George's Healthcare Alliance is also a partner. Most of their staff are certified community health workers, and they not only help us with access to health coverage, but they also do care coordination on behalf of people that get coverage because not everybody has a medical home. So they provide assistance with that. And they're going to be a strong outreach partner for us in FY23. And they're going to be working very closely with the Public Housing Authority and trying to find out who in public housing and some of these large apartment complexes need access to health coverage. So we're really looking forward to working with them. And of course, one of our largest partners is the health department. Prince George's County, health department, really steps out there and integrates our messages. We're going to do a lot more in reach this year within the Department of Social Services and the health department to make sure that every program that touches a resident in Prince George's County talks about the opportunity to access health coverage. So we're going to be doing a lot of that too. And then another partner of ours is the Primary Care Coalition of Montgomery County. And they've been doing our data analysis and they manage our database and they help us count how many people we're touching. And they also develop a lot of opportunities for us to take a look at the data statewide and countywide and what zip codes are showing the largest numbers of uninsured. So we know where to target our efforts and we know which populations to really go after. And then we have, our unpaid partners that are diehards, the library,
Mhm.
your office, the Office of Community Relations at the County Executive's Office has been just tremendous this year. And almost every smaller organization that has an interest in health coverage invites us to present at their events. They give us opportunities to table and they bring our message to the people that they serve. So we have nice arteries and arms in the community, and our goal is to just extend and expand it even more. We want to reach more special populations. We want to get to the, LGBTQ plus community. We want to get to the young invincibles. And that's another organization that has been a great partner of ours, an unpaid partner that is willing to do whatever they can to reach those young invincibles who think they don't need insurance. And they've been a wonderful partner too. And I'm probably leaving out one or two, but I think you can see, and everybody who's listening can see, that we have expansive reach into the community, and we want more. We want to get more into the Ethiopian communities. We want to get more into the Asian communities. We want to understand, what their needs are, and to be able to talk to them so that we can make sure that they feel comfortable coming into our program and getting health insurance for themselves and their families. So, we're here.
So about outreach, it sounds like you do a lot and you leverage a lot. If there was somebody listening or organization, maybe there's a religious group that is going to do some kind of family day, can they just reach out to your office using the same phone number to call you and invite you to come out? Or is there a special thing they need to do?
They can call the 927 number 4500 and say they heard this presentation, and you've already met Michelle Lassane, who is our outreach manager for the program. And, Michelle will reach out to them and see what they're all about. And we have navigators and outreach specialists that we can deploy to support that. Or sometimes we just need to give them materials, and they'll distribute the materials. So absolutely. If they call 301-927-4500, one of the navigators that answers the phone will share that information with our outreach coordinator.
Okay, I'm putting that back up on the screen. I won't try and say it again because that didn't go well last time, putting that up on the screen. I've also put links in the chat. So I don't think I got all of the organizations, but I did get most of the organizations that Shari mentioned, the outreach partner events, and I'm hoping that people who are watching or watching later can look into the chat and learn more about these partners.
And they're on our website. If you go to pgchealthconnect.org, all of our partners are on our website.
Okay, awesome. Because we do want to highlight all those people doing that work. Okay, so again, for anybody watching, please type in any questions if you have any. We want to make sure that we get you the information that you need. One of the things that kind of the focus that we wanted to also touch on, and we may have covered this, so I don't want to circle you back if we don't need to go there, but are there special barriers or that in terms of outreach that you're doing to reach Latinos in Prince George's County? This is really one of the themes we wanted to talk about tonight was really barriers to health insurance access or challenges to health insurance access and how you are trying to meet them and how we as folks in the county can also help meet those resources.
For the Latino community, we actually, more than half of our staff actually is bilingual. So the barriers in language, they're actually none, since we try to communicate with them in the language they feel comfortable with. And like Shari mentioned, if they had any questions or if they're concerned about their kids' insurance, they're feel really comfortable coming towards and asking the questions that they need. And like I said, at first, we try to go to the schools as well to do the presentation so they are aware. And we try to do the presentations in Spanish. So if they feel like they can ask the question in Spanish instead, then they will go ahead and do that as well. But when in terms of barriers, the only barriers that I actually see, if Shari can correct me if I'm wrong, it's just the undocumented part where they do want to access health, but because of that piece of information that they don't have, they can't access the healthcare that they need. Mm-hmm. But like Shari, going back to what Shari stated, even if they don't, they should not stop seeking help because their kids might be eligible for healthcare benefits as well. Mm-hmm. So that's the only barrier that I see. But if Shari has any others that I can't think of right now.
Well, I don't know if there's so much barriers, but one of the things that we've done, because we recognize that people are comfortable talking to people where they already seek other services.
Mm-hmm.
So that's part of the reason why we have partners like CASA and partners like SEED. And we also have staff that's located at the Multi-Service Center in La Union Mall in Hyattsville, where there's a number of services there offered by the health department, as well as by social services, as well as by our program.
Mm.
So we are co-located in a lot of places where people come for other services. So the referral process is a little more seamless than running them all over the place, because we try to operate at the Department of Social Services and no wrong door policy. So if somebody comes in even for another service and they also need health insurance, they're directed to us, right away.
Right.
And so we're embedded in the Hispanic Latino community, in full force. And it's not as much of a challenge for us
Mm-hmm.
as it is making sure they understand that this is a safe place for them to
Right.
come
Right.
and learn about their eligibility.
Right. Yeah, and I think that's and I think that's maybe the theme that I've gotten throughout our conversation is just don't be afraid to make the call. I say something to my kids just in general, which is don't close the door, let the universe close the door for you. Just keep walking towards something. And I actually am getting that message from you as it relates to health insurance, right? Like, don't assume you can't get it. We've talked about maybe people, I mean, you mentioned maybe people who are self-employed as artists or musicians who maybe don't think that they would be eligible or don't think to seek it out. And what I'm really hearing is like, don't close the door.
And a
Come
lot of
talk to you.
businesses are like sole proprietorship with maybe
Mhm.
one or two people,
Right.
and they're eligible as well. I mean, small business owners or people that are sole proprietors or people that are consultants. We get a lot of people that it's just themselves and they need coverage, and
Right.
and they find that they're eligible when otherwise they thought, because they were independent contractors, that maybe they couldn't get coverage. And they can, and they do, and they get excited.
Right. So we are coming sort of close to the end of time, but I did want to ask, so because of that, I don't want to ask a question and see, is there something that either one of you want to really highlight or bring forward that we haven't talked about yet?
All I want to say is don't be afraid. Like you said, we're here to help you. We're not here to say you can't, you won't. We're here to say, let's find a solution. Let's find a way. And like Shari said, we're not the ones providing the health, but we're providing the path. We're helping you. We're guiding you. We want to make sure that you have what you need. And if health, it's, as we know, it's a very essential part of our lives.
Mhm.
So we are here, and you can use us. You can help us. You can call us. You can visit us. Please come and see us. We're at Department of Social Service and at our storefront as well. And if you can't come, then call us. We're here to help you.
Yeah, and I could share a little bit about our locations, because we are sort of all over the place. So we have 3 local offices of the Department of Social Services that are opened every day. And navigators are available most days of the week at either one of those locations. We have a location in Penn Station Shopping Center, and it's a storefront location. A lot of times people really don't want to go to a government office or feel like they don't want to interact in a government space.
Right.
So we do have a storefront model so that people can go just as if they were going to the dollar store or to get a haircut. They can go to our storefront location at Penn Station Shopping Center. And all of this information is on our website.
Okay.
And it's in District Heights, right on the borderline of District Heights and Suitland. And we're open most days there from 9 to 4. And all of our hours of operation are on the website. Like I said, we're also at La Union Mall in Hyattsville, and most people in the Latin community know about La Union, and we are there. And people can get access to not only health coverage, but they can also get access to other programs run by the health department, and there are social services case managers on those sites as well. And we cast a wide net. I think the only other aspect of our program we didn't highlight was our insurance brokers, because we do have brokers that are authorized producers and they're certified through the state to be able to assist consumers with trying to select their plans and helping them understand. So people who want a private plan get all kerfuffled over, do I want a silver plan? Do I want a gold plan? Is this the one where if I only have $300 a month, what can I get for that amount? And brokers have been really wonderful. We have a nice group of brokers that have been working with us over the years and have established good relationships with our consumers, to help them navigate that private plan, extra questions that they need to know about costs. And they've been able to do wonderful work with our consumers on helping them identify the plan that suits their budget and their needs.
So is a navigator helps navigate the system and also makes referrals to other agencies if needed, and just provides almost like a companion through the process, and
for enrollment.
For enrollment.
Enrollment assistant, right.
And broker helps you choose which plan you'd like to be enrolled in. Is that right?
If you can't make that decision when you're working with the navigator and you're really confused about which one will work best for you, once your eligibility is determined and you've been eligible to enroll in the program, a lot of times we hand the consumer off to a broker to sort of close the deal and finish it for you.
Okay. Awesome. Okay. Well, this has been, for me, as very informative, and I hope for people watching as well that you've gotten information, who to call, to go to PGC Health Connect. Let me just make sure I get it all right, because I'm going to look, because I messed it up last time. You can go to pgchealthconnect.org. You can call 301-927-45, that's a 4500, and get information, learn about enrollment. And I think the big thing that I'm also really hearing is tell people, tell your young people, tell your neighbors, tell your grandparents, tell your grandkids, and just make sure that, there's going to be somebody. I really heard that from both of you, that there's somebody in all of our lives that has not yet enrolled and probably might not even know that they're eligible. So we all have a part in spreading the word. I want to thank you for a couple things. First of all, both of you for being here today and taking the time to be with us and to sharing the word with the residents of the county, because that work is so important. So I really thank you for that. And I also thank you both for the work that you're doing every day. And as I said, I saw during COVID, I saw your messaging. I saw the extended periods and what that meant for you. What you are doing for the residents of our county every day is absolutely critical work. So I really want to take a moment on behalf of us, the residents of the county, to thank both of you. It's really huge.
It's our pleasure to serve. It really is.
Thank you. For those of you watching at home, we are out of time. So I want to thank you for watching, and hopefully you can take the message here today. If you're not enrolled in health insurance, you're not sure if you're eligible, even if you're convinced you're not eligible, my takeaway is that you should give them a call and find out for sure. Try and get enrolled. Health insurance is critical. We know that our health is just it is the foundation of our lives. And so to get health insurance allows all of us to get the care that we need to have the most full lives that we can for as long as we can. So I really encourage you all to do what you can to get enrolled, to get a friend enrolled. And I also want to take a moment and thank the Prince George's County Memorial Library System. You heard them mentioned by Shari as a wonderful partner to Prince George's County Health Connect. They have been an extraordinary partner to our office, the Prince George's County Office of Human Rights. And in fact, they are bringing you this event tonight. But I think for all of us out here in Prince George's County, we know that the library system touches so much of all that we do. And so thank you very much to the library. And so that is it for tonight. Thank you all for tuning in. And again, Milvia and Shari, thank you so much for your time tonight and everything that you're doing.
It was nice to meet you, Kyla, and invite us back anytime.
Oh, yes. Absolutely. We'll be talking more. All right. Good night, everybody. Thank you.
Good night.